Hi, my name is Shikha Sharma. The topic that I'm going to discuss about is bronchial hygiene. So bronchial hygiene therapy is a vast term which is used to describe various airway clearance techniques that includes chest physiotherapy and breathing exercises. Chest physiotherapy includes percussion, vibration, shaking, suctioning, postural drainage, all these techniques, which is often associated with the breathing exercises. For example, diaphragmatic breathing, segmental breathing, huffing, coughing, all of these techniques to expectorate the mucus which is present in the lungs. So the aim of this technique is to remove the secretion and lung clearance. Otherwise, this will lead to respiratory infection, pneumonia, other complications, reduced breathing capacities and other acute respiratory conditions. The aim would be first to mobilize the secretion from the periphery to the central airways. From the central airways, they can be suctioned out easily. Second is to remove the secretions and mucus. This can be done with the help of modalities and aids. Third is to improve the gaseous exchange, and the fourth is the aeration and lung expansion. This improves the respiratory capacity and volumes. If this doesn't happen, if we do not clear the lung airways, this would lead to first abnormality in the airway exchange or the pattern of airway. The second would be the mucociliary dysfunction. Third would be the strength of breathing muscles will be reduced. And the fourth would be there would be reduced cough reflex. This would lead to mucus retention in the segments. Alright. So the cough which is present in the airways, that creates a negative pressure that leads to deposition or the accumulation of the secretions in the segments. So that is removed with the help of bronchial hygiene technique. Alright, so when a chest physiotherapy is done to a patient or is given to a patient, the physiotherapist has planned some short-term goals and some long-term goals in his mind. So when we talk about the short-term goals we go for, this is done to prevent the accumulations of the mucus. Second is for the drainage and mobilization of the secretions. Third is that this bronchial hygiene therapy is given in the patient of atelectasis, and the fourth would be this prevents the respiratory infections and further complications due to mucus retention. The fifth would be this promotes the relaxation. So basically these exercises, the breathing exercises and also the breathing exercises and the chest physiotherapy is done for the relaxation of the patient. This also promotes the breathing pattern of the patient. The patient who are on ventilation, this chest physiotherapy helps to promote the early weaning of the ventilation. If we have to keep the long-term goals in mind, the first would be to improve the aerobic capacity of the patient, which ultimately leads to improve the exercise tolerance of the patient. Further, if we proceed further, so as we know that cardiopulmonary physical therapy intervention is directed at achieving a specific goals, which is related to optimizing the oxygen transport in the patient. So also we know that human body functions optimally when it is in upright position and moving. So multiple interventions, these are often indicated to address multiple goals in a patient which is associated or which is determined from the assessment of the patient along with the history assessments, the contraindication and the side effect. So all these things are taken into consideration to prescribe a particular type of physical therapy for different condition of different patients. So then I'll be talking about different kind of techniques that is used for the patients. For example, the kind of breathing exercises or the kind of chest physiotherapy which is done for the patient for the expectorations of the secretions. So first I would like to talk about the mobilization and exercise. So the goal of mobilization in exercise is to prevent the effect, the counter negative effect of the restriction of the mobility as the patient is not moving. So this leads to a counter negative effect in the segment of the lung. So when we use any technique of if we mobilize the secretion, this prevents this negative effect and creates a positive effect behind the mucus that leads to mobilizing the secretion from the peripheral airways to the central airways, and from the central airways, with the help of any aid or device, we expectorate the secretions easily. So first technique would be the mobilization and exercises. If we have to know the acute effect of the mobilization and exercise, this would be that this increases the alveolar ventilation, and the second would be the airway clearance. All right. Also, the mucociliary transport is also enhanced with this. And if we talk about the long-term effect, this enhances the oxygen transport efficiency. All right. So then, if we proceed further, we are going to talk about body positioning, which is the second technique. So the body positioning, the goal of body positioning is to relieve the dyspnea and increased work of breathing. All right. So for the patient in increased work of breathing, we use body positioning. This is done to elicit a gravitational stimulus. Gravitation stimulates the mucus that leads to facilitation of the transport of the mucus from the periphery to the central airways. The third technique would be breathing control maneuvers. We use this. The goal of this maneuver is to augment alveolar ventilations, to facilitate the mucociliary transport, and to stimulate the coughing. All right. So first maneuver is pursed lip breathing. The second is autogenic drainage. The third is incentive spirometry. The fourth is sustained maximal inspiration. And also the fifth would be the effective coughing technique. For example, when we coordinate the inspiratory phase with the extension of the body and expiratory phase with the flexion movement of the body. This helps the cough to easily get transport from the peripheral airways to the central. See, again we're talking about the mobilization of the mucus. So this is very important to mobilize the secretion either via cough, either via any mechanical devices, or by any other maneuver to just transport or to facilitate the movement of the cough, the movement of the mucus from the peripheral airways to the central airways. All right. Then fourth is the cuffing maneuver. The goal of cuffing maneuver is to facilitate the mucociliary clearance. All right. So we use cuffing and huffing in this technique. This is very simple. We know about it. Then fifth technique I'm going to talk about is the relaxation and energy conservation and interventions. So when we talk about the energy conservation interventions, the goal for this is to minimize the work of breathing, work of breathing of the patient. In the patient in which the oxygen demand is high. So the interventions that will include is first is to improve the quality and quantity of night sleep. All right. When these relaxation techniques are done or on the patients, that leads to improve the quality and quantity of night sleep, which is very important. People are really dealing with this situation that leads to mental depression and other conditions. So relaxation exercises are always helpful in these patients. Second is the pain control interventions. This is given for the relaxation is given in the patients in which there is severe pain, patients suffering from severe pain. These interventions are really helpful. Then I'll be talking about the range of motion exercises. This is the other technique. This is basically the cardiopulmonary indications. when we talk about range of motion exercises, this is done to stimulate the alveolar ventilation and to alter its distributions. All right. So we go for active range of motions, active assisted range of motions, and also the passive range of motions. All right. Then the other technique, which is the 7th technique, is the postural drainage positioning. So the goal of this postural drainage position is to facilitate airway clearance using the gravitational effect. The patient needs to be lying in a particular position according to the segment that is affected. All right. So the 8th technique would be the manual techniques. The goal of manual technique is to facilitate airway clearance, which is associated with specific body positioning. All right. So there are several techniques that we do. First is the autogenic drainage. Second is the manual percussions. Third is the shaking and vibrations, and the fourth is deep breathing and coughing. We all know that we often combine the vibration, shaking and percussion technique along with the postural drainage, all right, because that makes it easy for the mucus to get expectorated easily. All right. Then we have 9th technique is the suctioning. The goal of suctioning is basically to facilitate the removal of these airway secretions or the mucus that is accumulated. We just have to suction it out. All right. So for this we use the manual inflation bag, which is also called bagging techniques. All right. Alright, so now I'm going to discuss about the modalities and aids that we use for the ease of expectoration. Alright, so the goal, for this is very important to know the goal of these modalities and all the mechanical devices that we use. So the goal is to incorporate the use of modalities and aids that enhances the preceding interventions. That whatever the interventions we're using, we just need to enhance its effect on the patient. All right. So the following I'm going to discuss about some of the modalities that we used. First is the treadmill. Then there are bed pedals. Then there are rowing machines that can be used. Then we have weights, pulleys, monkey bars. Nebulizers are also used. Flutters are also used. Flutters are basically the oscillatory ball resistance. The resistance is provided based on the color codes. These color codes are named based on the amount of resistance that they provide. So these oscillatory balls basically produces or creates a positive effect behind the mucus that is being accumulated in the lung, and then this is easy for the mucus to transport towards the central airways. All right. Then we also use the incentive spirometry, etc. Now, the prescription is based on the underlying etiology of the cardiopulmonary dysfunction. That is an analysis of various type of categories of the factors. This contributes to cardiopulmonary dysfunctions. So the prescription parameters, there are some prescription parameters. So these includes, first is the type of mobilization or the exercises that is given to the patient. Second is the intensity. Intensity can differ patient to patient according to the age of the patient, according to the number of days, post-op days of the patient. It could be due to the mental status of the patient or the condition that he is suffering. So all these factors decides the intensity. Third is the duration, is also the parameter. Fourth, frequency, very important parameter, and the fifth is the course and progression. Okay, so I would also like to discuss about the preoperative physiotherapy. All right, so first we are going to talk about to improve the breathing efficiency. So to improve the breathing exercises, we go for breathing exercises. All right, so breathing efficiency can be improved by performing the breathing exercises. The type of breathing exercises depends upon the patient, depends upon the conditions of the patient. So we can go for diaphragmatic breathing, we can go for segmental breathing, pursed lip breathing. Various kinds of breathing exercises are given to the patient according to the condition, age and the mental status of the patient, etc. Then second pre-operative physiotherapy is to ensure the clear lungs. So for this, we go for chest physiotherapy, which is shaking techniques, which is vibration, which is postural drainage, and basically to create the positive pressure behind the mucus. All right. The third is to teach the effective cuffing of the patient, and if the patient is not able to cuff, we can teach him or her huffing technique. So huffing can be initially be done by the patient and then progresses to cuff. All right. Fourth is to teach the correct technique of support the incision site by the help of bed sheet and pillows. So we teach that also. Fifth is to prevent the deep vein thrombosis. For that, we go for ankle pumps. We ask the patient to perform several times in a day ankle pump exercise and also the toe movement exercises. Sixth is to maintain the range of motion of the upper limb, also for the lower limb also, but for the upper limb is very basic. The shoulder girdle exercises, shoulder, elbow, wrist exercises, all these are taught. Then to teach the postural awareness. So in the lying position, in the supine lying position, we teach the patient to put weight equally, that he or she should take weight equally on both the buttocks. Alright. So then we also teach the patient turnings. Turnings in the bed, sitting, standing, walking. So these progressions are made step by step. For example, turning from the supine lying to the side lying and then out of the bed. Alright, and then from out of the bed we teach the standing and then progressively walking on toes. So all these things are taught to the patient. Now we are going to proceed further to post-operative physiotherapy. So to prevent this, there is to prevent the deep vein thrombosis, for example, we go for ankle and toe movement exercises, ankle pumps that we have already discussed in the preoperative treatment. So in preoperative and also in the postoperative, because in some cases patient is going to for the bedline position for for extended number of days. So to prevent the deep vein thrombosis, this is very important for the patient to learn the ankle pumps. Second, in post-operative physiotherapy, we go for the exercises of clear airways. So we go for breathing exercises. Depending upon the type of condition, we can teach pursed lip breathing, we can teach the segmental breathing, we can teach the diaphragmatic breathing. And then to maintain the good posture, we ask the patient, if in supine lying position, to take the weight on both the buttocks, if in the standing position, to take the weight on both the foot. Then further progressing further, the fourth is to maintain the shoulder mobility, neck mobility, trunk mobility, and also the legs mobility. So according to the part of the body, we teach the exercises of the particular part. For example, shoulder girdle exercises, neck exercises, trunk exercises, lower limb movements. All these parts are being exercised properly in a proper manner. Then we also teach to restore the patient confidence, because after operation the patient often loses its tolerance level, or maybe he must be dealing with any mental stress. So for that we go for counseling. The patient is counseled really well, and for some relaxation we teach the breathing exercises, or all of these things help patient to increase its confidence. Then proceeding further, we go for the exercise tolerance also. So for exercise tolerance, we go for the number of sets are also taken care of. The number of repetitions are also care of. Relaxation techniques are taught to the patient. And for the seventh is to teach the patient the home exercise program, because now or tomorrow the patient is going to get discharged. So once the operation is done, we have to teach patient, or we have to prepare the patient for the discharge, so that he can perform all these things even in the house. So the home exercise is very important. The patient should know that which exercise is for what, because then only patient will be able to know the importance of that exercise, and there will be good compliance. All right, this gives good compliance to the patient. So complete rehab program is being taught to the patient, including the diet management, the regular walking, and the exercise. So I think that is all about the bronchial hygiene therapy. This is a very vast term and a very big topic, but I just wanted to give a overview on this, that what all basic things we do in the bronchial hygiene. So I hope that this video was helpful to you all, and thank you so much.